Miracle, and we're back with another episode of Mindful Mondays with Miracle. This episode, we're talking about PTSD, and our special guest today is Rashida.
Hey y'all, my name is Rashida. I'm an outpatient mental health therapist in Tennessee. My degree is in social work. I just play the role as a mental health therapist. So what I do is I see clients from age 3 all the way up, and what I do is individual counseling, family counseling. I haven't ventured into group counseling just yet, but that's something that I'm working on. And I see clients with all kinds of disorders, but I've definitely worked with a lot of clients that have PTSD. And what I found is there are a lot of adults and children that have PTSD from like numerous situations that they've gone through and that type of thing. So we usually use the DSM as like our framework to be able to diagnose people who might have PTSD. And by definition of the DSM-5, they usually focus on sexual trauma and physical trauma. But from what I've found working with clients is that you can have PTSD from literally anything. A car accident, you can have it from witnessing something happen to somebody. You can have it from, like I said, probably literally anything. And it doesn't have to be something that just happens to you. You can have PTSD from witnessing it happen to someone else, or like knowing that it happened to someone else. And what I found is that a lot of adults have PTSD. They've gone through things throughout their life, and they've grown up to be adults who function biologically like adults, but mentally and emotionally they're still stuck in that phase of childhood because of things that they've gone through. And so when I do an initial intake assessment, which is what their very first appointment with me, I look for different signs and symptoms. Like most of them come in and they say they have anxiety or they have depression, and that's usually a red flag for me that they might have PTSD, because a lot of symptoms with anxiety and depression, they show up together as PTSD. So like when they have that excessive worry, hypervigilance, they're paranoid, they can't trust people, they dissociate, which means that they, like when you're talking to people sometimes and they kind of doze out or they zone out and that type of thing, they have those type of symptoms. They have some depression. It's hard for them to eat, it's hard for them to sleep, and it's just really hard to function. I look for those type of things, and I'm also I'm a visual person, so I pay attention to how they act when I'm talking to them and how they react when I ask them certain questions, because we have a question on there that asks mostly about sexual and physical abuse. And so I ask them, have they had physical, sexual, verbal, or psychological abuse, because you can have PTSD from like emotional and psychological abuse as well. And I pay attention to their mannerisms when I ask them that question. And so if they start to tense up, or their tone of voice changes, or they pause for a while, and I see them zone out or something like that, I can usually tell that they've gone through some kind of trauma or abuse. And I always ask them the question about who were you raised by? Just tell me 1 or 2 words that describe your childhood. Who are your siblings? Who did you spend most of your time with as a child? How are your relationships? How many times have you been married? Those type of things give me like different clues as to what they might have gone through, and it leads me to what their diagnosis might be. So that helps me to kind of set the framework. Okay, they have PTSD. I know it might take me a while to get to them addressing that, whatever it is that caused them to have that trauma. And sometimes people come in and they just say flat out, I lost my, I was in a horrific car accident, I lost my child, and I'm suffering from depression and anxiety because of it. I don't know how to function. I have nightmares, I have flashbacks, and those type of things. It's just really, it's difficult to work with those type of clients, because there are those clients who want to address those things. Some clients have suppressed things so much that you have to dig, because I do have a client where we've had to dig and figure out, because she says, I only remember my childhood up to this point. and usually when people have that situation where they only remember things up to a certain point, it's because they've suppressed things so much, and it's like it's your brain's reaction that when you go through something, your brain tries to protect you, so it might push it to the back of your mind. And so because she said she can only remember things to a certain point, that triggered in my mind, okay, something happened, her brain had to react to it, and so we need to figure out what it is that happened. And through therapy with her, we found out that she was molested by her sister's friend. And it happened around that time where she says she can't remember whatever it is. So it took us a while to get to that place, because I've been seeing her for a while, so it took us a while to get to that point. And then I have other clients who they know what their trauma is, but they don't want to touch it. Because I have one, her brother was killed, but she does not want to touch any of that trauma, and she saw him get killed. And I can tell from my perspective, my clinical perspective, that she probably needs to address it, because if she doesn't, it's going to keep holding her back. But I can't force her to do it, because if I push her too far, she's not going to want to address it. Because clients, especially from social workers' perspective, they have that right to self-determination. So they have the right to say, I don't want to address this no matter what the consequences might be. And for her, it's been a lot of consequences because she doesn't want to address that trauma. So I think as far as sexual trauma, I think that's one of those things that as far as addressing with PTSD, one of those things with me that I have a lot more empathy for people being able to address it, because I personally experienced it, and I can always usually tell when someone has gone through that. Of course, like with physical abuse, I witnessed it and that type of thing, and emotional and psychological abuse, I witnessed it. So I can address it, but sexual trauma is really something that I see a lot, and I have to focus on a lot, and I have a lot of empathy and concern for those people. And actually I worked with a lot of males who've experienced sexual trauma, and some of them aren't even aware, or they just or they minimize it because of like societal standards that tell them, oh, you're a man, you're supposed to do this and you're supposed to do that. No, someone who's older than you, whether it be a man or a woman, is not supposed to take advantage of you. So sometimes I do have to tell people and talk to them and point it out to them, that was some kind of trauma that you went through. Not that I'm reaching or anything or trying to make them have some kind of trauma, but like just listening to them, like, no, you were this age, someone was older than you, and they had intercourse with you or they touched you. That's considered some kind of trauma that you went through, and that's probably why you do function this way because of this. So I've been able to just, like I said, work with a lot of men that I've noticed a lot.
So what event happened in your life that you feel might have caused you to have PTSD or PTSD symptoms?
I've had several. My first was when I was 14 years old. I had my virginity taken away from me by a 17-year-old, and that was my first sexual trauma. And I've had different sexual traumas over the years, but like that first one kind of set me up for a framework because of not being able to trust people, and it messed up my view of sex a lot, because in my mind, after that happened, I thought I was supposed to have sex with people so they wouldn't rape me, but because I didn't understand sex in relationships, it also set me up where when I got into different situations with different guys, I didn't know what the warning signs were. So like when someone would get close to me and I'm tensed up and I'm scared and all those other things, I don't know that that's not how I'm supposed to feel. I didn't know that if I told somebody to stop, that's what they're supposed to do. So it did kind of put me in a lot of situations where I did get raped a lot of more times. So that was one of those situations for me, well, multiple situations for me, where as far as sexual trauma, I witnessed my parents arguing a lot and just going back and forth and a lot of manipulation between them. So that gave me some emotional trauma. My brother passed away in 2014, and we got the phone call, and we're rushing up to Birmingham to try to see him. And he was the first person in our like close family, immediate family, who like passed away. And so I got the phone call. Me and my mom are like rushing to Birmingham to try to get to him, and then we got a second phone call that he passed away. So like it's something I've been working on, but even to this day, when I get a phone call from anyone in my family, I automatically get really tense, and I get really scared, and sometimes I start sweating because I don't know if they're going to tell me that someone is dying or someone is dead. So that's another thing as far as like with PTSD. For me, like just hearing the phone, I get like really anxious, and I'm like, oh my gosh, is somebody dead? Is somebody dying? Or that type of thing. Because I've had other family members who they're like, well, such and such is dead, such and such she got shot in the head, such and such is in the hospital, and this is happening and that is happening. But just that situation along with my brother has like given me some PTSD symptoms. And what I've noticed in myself as far as symptoms is with males, and I worked on it of course in my own therapy, is like if they get too close to me or like they touch me in certain areas, I get really scared and I tense up because I don't know what they're going to do. It's hard for me to trust people because I don't know what their intentions are. But at the same time, since I've been able to go through therapy and those type of things, I've been able to see different warning signs and red flags that let me know that person is not good for you. This person is probably going to try to hurt you and that type of thing. Just being observant all the time. It's a good thing for me now that I observe a lot of things, but when I didn't have control over it, trying to make sure I observe my surroundings and observe and pay attention to this person's mannerisms and that type of thing. A lot of depression. Let me see what else. Weight loss. Like sometimes I used to eat a lot, then I would stop eating and I would go back and forth. A lack of concentration and those type of things. And something else I just thought of as far as PTSD, I witnessed someone get killed in front of me, so now I'm afraid of guns. Like I don't like guns because I witnessed somebody get killed in front of me. So I don't like guns. I barely like fireworks because now I can tell the difference between a gunshot and a firework now, which is kind of hard to do when you think about it, but I'm definitely afraid of guns because I've seen somebody get shot. And I remember at that point in my life, I went through a whole bunch of depression and I didn't want to go outside, and that kind of started like for me as far as a thing with phones, like if someone called, I was thinking that it was going to be the person who I saw kill the other person. So I was scared of phones for a really long time. Obviously I'm not afraid of phones anymore, but like phone calls and stuff are kind of still touchy for me. Like I don't answer calls that I don't know. For real, I send them
numbers and stuff.
Yeah, no, I send them. I send them the voicemail. If it's important, they're gonna leave a voicemail. But I'm not as intense as I was, and like most of this stuff happened around the time I was like 14 or 15. So it was like PTSD symptoms from like 14 all the way to how old am I? Till about last year.
And how old are you?
25. So like 10 years of like untreated PTSD. So I was able to start getting help when I got a good job with good insurance.
So when you were saying the phone thing, is it more, when you get phones at nighttime, like middle of the night, is it, or does it matter when you get the phone calls that kind of scare you and make you tense up and stuff?
If it's early in the morning, I get kind of scared because I got the phone call about my grandmother passing away early in the morning. If it's my dad or my sister, I get really suspicious because they're usually the ones who's telling me some kind of bad news or something. Or if it's my cousin, they're usually the one who's telling me the bad news. So I get tense. It's not as bad as it was like a few years ago, but like I still have that. Okay, is somebody dying? Please let me know. So like when I answer, I pause and wait for them to say something. So I can know, okay, can I breathe now?
Yeah.
But like since I've been able to, as far as like get closer to God and stuff, and like trust Him and that type of thing, it's gotten way better. Cause like I would just text me, don't call me, just text me, I don't
So
know.
since you're a social worker and you have 14 from age 14 about 24 years of PTSD. How do you feel about therapy now? Since you're a social worker and then since you've been in it.
I love therapy. I'm an advocate for therapy. I had a teacher ask me one time, she said, so would you want somebody teaching your kids if they go to therapy? And I said, I would be pretty suspicious and pretty concerned if they didn't go to therapy, because literally everyone has nobody's life is perfect. So literally everybody has gone through something in their life that would cause them to, even if it's not forever, to at least go talk to someone who's a professional, who's been trained in it, who's completely unbiased, to hear some things from them, get some coping skills, and be able to talk to them. And especially for Black people, yes, I'm gonna say Black people definitely. We have I would definitely say we have some historical PTSD that's probably been passed down, and I'm not gonna go too into it because I talk a lot. But definitely Black people need to go to therapy. There is every time a client comes in and they're like, I'm crazy, I definitely tell them, no, you're not crazy. I don't like that word. Take that word out of your vocabulary. You're just somebody who's been through something, and everybody goes through everything differently. So what might be traumatic to her might not be traumatic to me, but I can't minimize what her trauma is. So I love therapy. I love going to see my therapist. I know people are probably like, well, you're a therapist, why would you go to a therapist? Because I'm a therapist. And so I gotta load up. So I have to listen to people's problems all day and help them. And so sometimes it does become a burden listening to that all day. So I have to talk to someone else who understands that burden and who can also be unbiased and just let me know that I'm okay. And also because I'm human and I'm not a therapist 24/7, even though I'm a social worker, even when I'm at work and when I'm not at work, I'm still a human. So I still go through stuff. I still have family issues. I still have like childhood issues. I still have things that I've gone through. So I have to go to therapy and get those things worked out, because I don't think any of my clients would listen to me or even take in what I'm saying if they didn't feel like they can relate to me, and if they didn't feel like they could have some kind of hope, like, oh, okay, you went through this and you got help for it, so maybe I can get some help for it too, and maybe I can get on the other side of it. So I definitely tell everybody to go to therapy. Go to therapy, not just get medications, because I explain it to people. If you break your leg and you just take the medications, you're never gonna learn how to use your leg again if you don't go to physical therapy.
Yeah.
So the same thing with mental health therapy. You can take the medications all you want to. Those are not gonna take away your memories. It's not gonna take away those bad habits. It's not gonna take away any of those negative coping skills that you have. You have to be able to talk through that and reframe your mind. And no one would ever tell anybody with diabetes, you should stop taking your medicine, or you should stop doing this, and you should stop going to your doctor. Nobody would ever tell them that, because they understand that their physical health is important. So I ask a lot of people, why is your mental health any less important than your physical health, when they're both together? You can't function without your brain. Your brain is made up of your mind, and then your brain also tells your body what to do. So why would you not work on your mental health and make sure your mental health is okay, when that's basically your framework for everything?
So if you could go back and speak to 14-year-old Rashida, what would you tell her that since you've gone through therapy and since all the stuff you've went through, what would you tell 14-year-old Rashida that you wish someone could have told you, or you wish you would have known?
So I'm writing a book on that, but I would probably tell 14-year-old me that I love you,
Why do you say that?
Because I don't think I understood that. I don't think I loved myself at that age, and I don't think I understood my worth or my value at that age either. So I would definitely tell myself I love you, because I don't think I cared about myself that much. And I would definitely tell myself, girl, wait till 11 years later, you gonna be lit. But I would definitely tell her to stick to God, because I can look back and see where God was speaking to me and like doing different things in my life way back then and even before, and I was just ignoring it because I was trying to be like everybody else, because everybody else was trying to do this and trying to do that, and I knew that I didn't fit in that things. I knew that that wasn't me, but I was trying to force myself to be into it. But I would definitely tell myself to stick to God, and just because you don't fit in with everybody else, it's not a bad thing at all. You were literally made to stick out, and it's definitely okay. And I would definitely tell myself that the love that you're looking for and that void that you're trying to fill, that's God. That is not going to be found in a guy. That's not going to be found in your family. It's not going to be found in alcohol or drugs or nothing like that, or sex. It's going to only be found in Jesus. And I would definitely give my 14-year-old self a hug, because I don't think anyone ever hugged me, because when that happened to me, the situation was that my mom thought that I was sneaking out to be with someone. So she like had baby powder by the door and that type of thing. So she called me when I came in, and so I got in trouble for that. And so I had to suffer through a whole summer getting in trouble because they thought I was out having sex when the real thing was that I had just got raped. But I didn't feel like I had the space to tell my parents that the boy across the street, he raped me. I couldn't tell them that because of the culture of black people, especially in the hood, if y'all know what I'm saying. Like, trying to tell them that. So the only person who knew was my twin and my niece, and I think she was really young then, and she still remembers to that day me walking in and crying and saying that he raped me. So I had to suffer through a whole summer of not being able to tell anybody. I didn't want to tell my daddy, especially because I just knew my daddy would go to jail and try to kill him because he stayed across the street. And I had to suffer through a whole school year of going to school with this person. And when I tried to tell somebody, they went around and told everybody else. And so him and his girlfriend and her sister tried to come fight me after school one day. So I had to not only suffer with what I was going through mentally and emotionally and physically, but I had to suffer through all the other stuff that came along with it. And even when I told my mom, she kind of minimized it. And she still kind of, till like, even like back to last year, she was telling the story about, I called Dee Dee coming in with baby powder, and I had to tell her, Mom, can you stop telling people that story? I was raped that day, and I need you to stop telling that story like it's funny. No, I had some sexual trauma that day, and I'm still in therapy because of what happened to me. And I think it kind of got into her head then, because she was like, I'm sorry, I didn't know. And I was like, well, Mama, and we was able to talk to it and stuff, but I had to suffer with that for so many, I would definitely say years, because even dealing with that, I had to also deal with the fact that I'm in this new neighborhood, my mom and daddy going back and forth. I'm dealing with the trauma of every time I start to try to plant, started trying to plant and make friends somewhere, we got to move somewhere else because Mom and Daddy, they into it again. And then I also experienced the trauma of seeing somebody else get killed. So that's something else. And then I had to go through my twin miscarrying her twins, and I had to go through that with her. Then my brother passed away. Then my grandmother passed away. Then I had other people, three family members pass away in 1 week, and it was just all and that was just over the past 10 years, just all building on top of each other. So I would definitely tell my 14-year-old self to go get some therapy. Stop taking the medicine and thinking it's just gonna go away. No, go get some therapy too. And I would definitely tell Black people to, when somebody tells you something, I don't care what the hood say, and I don't care what the culture is, you need to listen. Because I found out that my mom had been raped as well, and they just all swept it under the rug.
Yeah.
And my grandmother went through it, and then different people I know have went through it, and Black people sweep that under the rug, and it's really unhealthy for us to do that. And I definitely want to, and that's probably why I started to do therapy, because I wanted to be for someone else, another little girl, what I did not have, somebody to listen to. And it gives so much relief to a lot of people when they come into the clinic. Like, I've literally seen people's face light up when they come into the clinic and then they see a Black person.
Yeah.
Or a little Black girl sees a Black woman that she can talk to.
Well, Rashida, I thank you for, that was amazing. This was an amazing episode. So I thank you. So remember, it's nice to be nice, and it's okay not to be okay. So catch us next Monday for another episode of Mindful Mondays with Miracle. Mwah.